Hello everybody, my name is Matt. I'm one of the advanced practitioners that works here in the IMAP service at the Royal London Hospital. Today we're going to go through how to do a neurointegrity test of the upper limb. The first part of the neurointegrity test is sensation. What we want to do is compare left versus right to see if there's any discrepancy and make sure that that sensation feels normal or not. Okay? Liz, can you tell me whether there's any difference left compared to right? Okay, so does that feel the same as that? 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 Can you hold your hands out for me? Does that feel the same as that? Does that feel the same as that? Does that feel the same as that? Can you turn your palms over? Does that feel the same as that? 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 Can you bring your elbows a little bit wider? And does that feel the same as that? When testing sensation, you want to make sure that you cover all the dermatomal areas. The next part of neurointegrity testing is myotome strength. What you want to do is work from the top to the bottom, C1 to T1, and see whether there's any discrepancy from left compared to right. You want to hold each test for 5 seconds to elicit any subtle strength weakness. This is how I normally do it. So C1 would be cervical spine flexion, so push into my hand for me, Liz. C2, cervical spine extension. C3, cervical spine side flexion. And this way as well. C4 is shoulder elevation and push up against me. C5, elbows out to the sides and hold your elbows there while I push down. Okay, C6 is elbow flexion. So push up against my hand. And the other side, push up against my hand. C7, elbow extensions, push down against my hand. And push down against my hand. C8 is thumb extension, give me a thumbs up and push against my fingers. T1, fingers out wide, keep those fingers straight and now bring them together. Push as hard as you can. Very good, and relax. The next part of the neurointegrity test is reflexes. I like to look at the bicep and the tricep reflexes. To examine the bicep reflexes, you have to ask the patient to relax their arm and place their hands palm up on their lap. I like to feel the biceps tendon with my thumb and then just tap my thumb. You would compare it to the other side to see whether there's any difference. There's a couple of ways of doing the triceps. What the first way is you want to hold the elbow at 90 degrees, ask the patient to relax and tap the triceps tendon. Another way of doing it is to bring their elbow out to the side of out away from the body and again tap in the triceps tendon. The final part of a neurointegrity test is looking for upper motor neuron signs. A common way of doing that is Hoffman's test. What you want to do is flick down against the middle finger and pull up. Then you want to look to see whether there's any involuntary flexion of the thumb or index finger.